Hello, class of 2021 and 2022. I hope you all are doing well and enjoying your third week in the virtual classroom. We're really proud of all of you again, how well things are going, how engaged you guys are in your classes, and really adjusting to this new normal that we have found ourselves in. We know this is really impacting your study strategies and learning the material in different ways. And so we just greatly appreciate your engagement and your commitment to helping us with this process. So I know you guys have read Dr. Marshall's email at this point. And first off, let me say, I understand that probably hit really hard to many of you. In the planning phases of trying to decide what we were going to do, your outcomes were in our first and foremost. So always in our minds thinking about how is this going to affect the students. We were thinking about things like, where are you going to find housing, timing of housing, things like family events that have been planned for years around your clinical dates, weddings, family reunions, family vacations, all of those things. And we understand that this change in clinical dates is going to impact several of those events. And first off, let me say I'm so sorry. If we didn't have to change it, we wouldn't. But unfortunately, at this day, and where the pandemic's at and the progress that it's made, we had to make a decision to move your clinicals. And like I said, it wasn't taken lightly, and it wasn't taken on a unilateral decision-making process. We had many stakeholders involved in this decision, our clinical partners, both locally and domestically. We've had our higher administration of the university involved, our department leadership team, and then even our collective faculty. Having these meetings and discussions, it was always a somber situation, knowing that this would affect you and could affect you in a negative way. And that's just not us. We don't want to do that. So please know from our heart of hearts that, we are doing this out of the best interest of your education and your progress in our program, and really keeping you in mind first and foremost. Just some background just to kind of think about, as we look at the lay of the land per se in clinical education, we have students going out to outpatient clinics, students going into inpatient acute and rehab settings. And, even though physical therapy is an essential business and physical therapists across the U.S. are actively working, censuses are very, very low right now. You have to think about, especially like in outpatient settings, elective surgeries have been canceled altogether. And so, a normal flow of post-operative patients is no longer coming in the door. And, you have people not getting out as much, which is following that social distancing directive and mitigation, which is a good thing. But that means we have less people coming in, less patients coming in the door. And when you have less patients coming in, you have difficulty paying your bills. And so then you have to begin to start having less employees. And so across the nation, many fellow physical therapists have been experiencing layoffs. And I have even seen posts on Facebook of friends of mine across the U.S. saying things like, I never expected having a doctorate degree that I would be filing for unemployment. And so, our fellow physical therapists are going through some really hard times as well. And I'm sure that you can understand, as maybe some of your parents are having to go through a similar situation. This is really, really hard for all of us. And the only way that we're going to get through this is together and banding together and building each other up together. And I know that's something that UE DPT can do because I've seen it and I've witnessed it. And I'm so proud of all of you because you guys always do come together as a group and really lift each other up and support each other. In light of that, even as the predictions have gone that this pandemic, as the virus will spike over the next couple weeks, and then start to level out and to decrease. Even if that is the case, and we're hopeful that that's the case, it's going to take some time for our clinical partners to really build their census back up and get back to a place where they can handle student education. And so we want to be mindful of that for our clinical partners, and we want to give them some breathing room. And that's why we chose the July 1 start, is to give our clinical partners some time to recover, have a chance to kind of work on building that census back up, and get to a point where they're ready to mentor you in the way that we know that they amazingly can. So I know that this is tough, guys, and thinking through this, kind of how this works logistically, that puts both of your cohorts in an 8-week clinical education. So from July 1 to August 26th. It is a Wednesday to a Wednesday. And so what that does allow us is to build in maybe some makeup days and things of that nature, because we want to work with you in case of these situations that you have had planned for years or months, that, family vacations or weddings and things that you just can't miss, or things like that. We want to work with you, but we also want to work with our clinical partners and be respectful of their time. So reach out to us if you have individual needs that just are not going to work with this new model. We want to work with you on making sure how we can make it work for everybody. Some of your clinicals may say, you know what, hey, we're doing great in June. Let's start earlier, and they're going to let us know that. They're going to reach out to us, and then individually we'll work with you to rearrange the kind of start date as needed. The other thing to kind of be thinking about is the fall academic calendar is going to look a little bit different. Both of your cohorts will now be on a 12-week fall semester beginning the day after Labor Day. And now this wasn't going to be unusual for the cohort of 2021. This has been our kind of new normal for entering into your final academic semester. But for the class of 2022, this will be a little bit different. And so we're going to be compacting our coursework into 12 weeks. And the good news is we have experience in doing that. And we're going to make sure that you're getting all the content that you need in a time frame that makes sense and is not overwhelming. And that's the other sense, is that you are in our forefront as we're designing that curriculum and designing how we're going to make sure that you get the content you need in the amount of time that you need to digest it as well. So I hope that helps clear up some things, some questions. We're really proud of you again, and understand that this can be really, really tough. And, hopefully we made these decisions in a timely manner for you to be able to work on your housing in different situations for your clinicals, and rearrange that. And also thinking about, kind of housing in the fall and all of those decisions. There's a lot of things to juggle and a lot of things to weigh as we're making these decisions. And, sometimes we don't have all the information we need to make a decision, because none of us can predict the future. So we're hopeful, and we do our best to make the decisions that we can with the information that we have. And we feel like this is a really strong and positive decision for your education, to be able to continue it on track and continue your progress towards your license as a physical therapist, as well as balancing that with supporting our clinical partners in the best way that we can. Again, as you have questions or concerns, please don't hesitate to reach out. I'm here, BH212. If you have any of those questions or concerns, I'm happy to work with you on that. I hope you guys are all doing well, and continue to engage in our classrooms, our virtual classrooms, and I look forward to seeing you all soon. Bye.